Heart attack is a disease where one of the main arteries that supplied blood to the heart muscle becomes completely blocked. And it's usually a combination of cholesterol partially plugging the artery, followed by sudden onset of a clot, which completely clogs the artery. And that leads to damage to the heart muscle. Usually it takes years to develop the partial blockage, and the major risk factors have been well studied. There are major risk factors that include diabetes, which can damage the arteries, high blood pressure, high cholesterol, smoking, and a family history, if someone in the family had heart disease at a young age. The classic symptoms of a heart attack are usually a chest pressure or tightness, usually right in the center of the chest or to the left side. It can be a heaviness, doesn't always have to be a pain. A lot of patients stay home with a heart attack because they say it really wasn't painful, but it's really more of a discomfort, a pressure-like sensation or squeezing in the chest. A lot of times there will be associated shortness of breath, sometimes nausea and vomiting, lightheadedness, but it's mainly a chest pressure or discomfort. About half of heart attacks in women, the women say they never had any chest discomfort. So the other things to watch for, especially in women, sometimes it's just feeling tired or fatigue or short of breath. If you just don't feel right, and it goes on for say more than 10 or 20 minutes, then it's worth a call to your doctor. A lot of patients will stay home, they convince themselves that it's heartburn, so it can feel similar to heartburn. Sometimes anxiety or stress will cause similar symptoms. But usually if it's a heart attack, it has to be consistent pressure or discomfort for more than 15 minutes or longer. Well, a heart attack is an emergency because the longer that artery is blocked, the more damage that is done to the heart muscle and the higher chance of not surviving. So any discomfort in the chest that lasts more than 10 or 15 minutes, if you have a history of heart disease especially, you should call 911, have an ambulance take you immediately to the emergency room. If you're not quite sure what to do, call your family physician if you've never seen a cardiologist, describe your symptoms, and they can help decide if you need to go to the emergency room. It's very common when patients have heart attacks that they stay home too long. Even if you stay home an extra hour, your chance of more permanent damage is much higher, and the chance of dying becomes much higher, because every minute that artery is blocked to the heart, that heart muscle is starting to die. They found if we open the blocked artery by 6 hours, then there can still be some benefit. If the artery is blocked more than 6 hours, there's permanent damage, and opening the artery won't do any good by then. But if you get in within an hour or two, the benefit is even greater. So every minute you wait, there's more permanent damage to that heart muscle. Once you get to the emergency room and tell the staff that you're having chest pain, you're a very high priority. They will take you right back and do an EKG. EKGs often will confirm the presence of a heart attack, and if that's what is happening, then we'll take you right to the cath lab, where we need to go up your leg with a catheter to get to the heart, put X-ray dye into the coronaries and see if it is totally blocked, and if it is, then we put a stent in there to open it. The sooner we open that artery, the less damage to the heart and the better chance for survival. Well, the good news is if you can identify your risk factors, you can cut your risk dramatically from ever having a heart attack. So there's been a lot of investigation into what can prevent heart attacks. We found if we do those things, we can cut your risk on average about 30%. If you do the right things, control the cholesterol, control the blood pressure, have a healthy diet, and give up smoking if you're a smoker. So those things alone can really make a big difference in prevention.
For more information about this physician or to schedule an appointment, please call our referral line or visit notbiggerjustbetterhealth.com.